This is one of UCSF's clinicians, doctorate practitioner, or practice of physical therapy, and he is Miss Dr. Christopher DaPrato.
We'll go with Mr. on that, but that's good. So welcome, and so it just hits the queuing for the thing. Okay. So I want to have a candid conversation with you guys on any questions that you have. We'll definitely make it as open as possible. Don't be afraid to interrupt me at all. Real quickly, I'm just going to kind of go through some of the things that we look at UCSF and what the UCSF SFSU program is all about. But pretty quickly, if we want to break into kind of specifics that you guys have questions-wise, again, I can relate to this program and kind of going through a couple other programs that I've gone through. My background is I've been a professor there for a couple of years at UCSF. I was a practice manager for the faculty practice there, meaning that we have a physical therapy clinic that's attached to the School of Medicine, integrated with professors that treat patients on a daily basis. And what that does, it provides an avenue for students to come in and interact and see real patients every day, as far as going through an outpatient center. So it's one of only 2 schools in California that has that. So USC and our program are the only ones that have a faculty practice attached to their Department of Physical Therapy. So it does provide a little bit more hands-on experience, as well as a little bit more up-to-date, state-of-the-art interventions as they relate to the way healthcare is moving. So it's definitely an area that makes it a little bit more cutting edge. So we do focus very highly on the clinical aspect of things. I know a lot of people associate UCSF, San Francisco State, with a more research-guided program, but we are definitely a clinical-driven program that produces very high-quality clinicians as our most important thing. Research dollars are very high at UCSF, which kind of lends itself to having a whole research allure to it, which is great. And if you want to go into research, we definitely have a lot of opportunities for that. But the program itself is actually very much geared towards producing the best clinician possible. And so we have a lot of hands-on opportunities for those different aspects of care with it. So just to kind of go through a couple things with UCSF, and then we'll kind of get to all PT programs in general, how to be more, I think, better applicant for that. We've been together with SFSU since 1989. It is a dual school program where you'll get 2 different degrees, or 2 different bodies that will administer the signatures for your degree. So it's both San Francisco State and UCSF. And it's nice to have a collaborative model because at UCSF, we're very well internationally known, and there's a lot of cutting-edge, state-of-the-art research going on, like I said. But at SFSU, it's a little bit more geared towards community involvement, helping underserved populations, kind of going into underserved economic, different areas that will provide more direct assistance to things that are there in the community. So you have kind of a nice dichotomy of both that are all in one program with that, which is very nice. So we have 2 different campuses that you'll teach classes on. So you can go to a class in the morning on one campus, and then in the afternoon will be on the other campus. So lots of opportunities to interact with different types of faculty, as well as different types of environments kind of going through. It is a 3-year program. It's a doctoral program. Again, it's one of those doctoral programs that have been around for a while. Some of the other institutions here in California have just kind of adopted the doctorate a couple years ago, and so our program's a little more established, and we've been accredited with the doctoral program for a few more years than some of the other ones. There are 50 students accepted, so it's a manageable class size where you're going to get a one-on-one attention like you would probably want to have, where it's not 90 students like some of the bigger institutions that are also well known. So you get a little bit more one-on-one time, and you're actually going to be able to interface with the faculty. There's definitely an open door policy for kind of coming in and asking questions in open hours and kind of going through things. So, and like I said, a lot of our clinicians treat in a facility, so you're going to see them in the classroom, but you're also going to see them interacting with real patients. And it's really not that common to see those interactions together side by side. Most of the programs do not have that type of ability to have the hands-on care directly in front of you as you're learning the material, and it creates again, your understanding on not just visual, but also kind of the hands-on aspects of things. So we have clinical internships that are integrated throughout the program. Some programs will have all the internships just at the end. Some of them will disperse them like ours do, and then some of them have them smattered in just the second year. It just depends on what the focus is. I think what's nice about our program is that we are geared to give you your longest and most important clinical in your third and final year. So it's basically the last thing you do before you graduate. So you finish on a Friday at your clinical rotation. The next Friday you graduate. The following week, hopefully you have job interviews. So it's really kind of gearing you to get out into the job market and be as successful as possible. The other thing that's very nice about UCSF is we're very much focused on interdisciplinary education. So you are actually learning side by side with the medical students and actually teaching some of the medical students their anatomy, because you get the cadaver lab first in the summer. You actually do pro-section on real cadavers, and then you prepare that for the nursing or the anatomy for the medical students. So it really kind of integrates this multidisciplinary approach, as well as coordinates a lot of the ways that you can interact with some of the other departments that are out there. So there's lots of learning centers. It's not just classroom work. We actually have a model where you can go into a live patient environment that doesn't have a real patient there, but you have all the facets of a live environment and practice on people and make mistakes without hurting another person, which is good, for most of the time. So that's one of those things that are, I think, a higher level institution like ours will be able to offer. That's different. Definitely our graduates are very, very good at passing their boards. It's a high level caliber student that comes in, but we make them very much ready to pass their boards so that they can go out and get a job. And I think that's a very key component for doing well with what you're trying to do. There are a lot of opportunities in the Bay Area coming out of school to get a job right away. And so it's nice to immerse yourself in that culture and understand some of the things that are going on there locally so that you have the best opportunity possible. This is just some of the curriculum that you're going to look at. Again, in the summer, early on, you're going to get lots of anatomy, lots of kinesiology. So a lot of the fundamental foundations that are really important. But like I said, it's really nice because you're going to interact with some of the nursing students, some of the medical students, and do a multidisciplinary approach to things. So there's lots of opportunities for those. You're going to go through lots of growth and development, pharmacology, some of the other things that are kind of going through that area. And you're right in year one going to get a clinical experience right out the gates with 16 hours in the clinic that first semester usually. So it's getting your feet wet early, getting a lot of foundational material and kind of going through that. Year two, you're getting a little more advanced aspects of orthopedics, neurology, psychosocial issues. We really strive to be community involved. So in San Francisco, it's a community of a very diverse population, both socioeconomic, sexual orientation, minorities. There's all kinds of different things that are there in an area like San Francisco that we need to still serve medical purposes for. And I think getting that experience prepares you for any type of setting that you want to go out for. So it's a very interesting, perspective of trying to collaborate that diversity and, again, getting a student population that's as diverse as possible to be able to interact with some of these things is very important for us too. Year three, again, we're getting a little more, specific sciences going towards therapeutic exercise, going through muscle and nerve biology, so that you really understand how to integrate advanced concepts. So it is the logical progression that we kind of go through. And there's a lot of clinical hands-on work. So most of the curriculum that I teach in is in the therapeutic exercise and manual therapy aspects of physical therapy. And so that's in the third year. And it's a little more advanced skill sets. And we actually bring the students into the clinic and practice on the tables using the equipment that you use in a real live physical therapy environment. So again, that opportunity is not going to be there at a lot of other programs that you will see where we are at. So again, San Francisco State has some different learning modules and lots of space for things. There's acute care training that we'll also offer through there. And then at the practice, we're about 4 blocks away from the Giants Stadium, right in Mission Bay. So it's a great location, and actually the last little bit of space that's open in San Francisco there. So it's a very nice, brand new facility. We've only been there for 3 years. And the orthopedic surgery department's on the second floor, so we integrate with them, and we send students down to observe surgeries if they want to watch surgeries in person. And it's a lot of great opportunities like that for the multidisciplinary approach. Anatomy Learning Centers got overhauled with I think a $13 million renovation just 3 years ago. So they're up on the 10th floor of the hospital wing there, and it has a beautiful view of the entire Golden Gate and the ocean out beyond. So it's one of the probably nicer anatomy labs ever made for this type of application. Very, very great new equipment, and lots of big TV monitors and things like that. Different types of learning centers that we have opportunities for as well. The other thing that UCSF brings a lot of is continuing education. So when you get your physical therapy degree, every 2 years after that, you're going to have to do continuing education units, just like medicine, just like nursing. And so we host other continuing education courses and bring our students into those courses so that they have opportunities to learn side by side with practicing clinicians. So that's another area that really makes it a nice learning environment to kind of practice things like differential diagnosis or manual therapy aspects or women's health. Lots of different types of continuing education that will come through the program there. So when we're talking about basic sciences, and this is kind of the meat and potatoes of what you guys have come here for probably, there is a very large emphasis on prerequisite science GPA and what those look like. So we look at not just overall GPA or science GPA, but your prerequisite classes, what your BA or BS was in, and what those units look like in terms of their GPA, and then the last 60 semester units. So that's kind of our equation for what we're trying to look at when we go through the screening process for a lot of the individuals. So these are kind of the essential courses that you're going to need to kind of go through and make sure that you have in your application ready to go. And like I talked in the last panel, it is something that we look favorably upon having 80% of it done when you apply. So if you can have 80% of your coursework done when you go to apply, it's going to look a little stronger than having 6 more classes to take in the spring, things that we're not going to necessarily assess before admitting or not admitting you. So that's another area of looking at. So the courses are kind of very, much like the other courses that all institutions are going to require. But then we also have some other courses that we highly recommend. Other science courses that will make you a little bit stronger and more competitive. And it's not something you necessarily have to have taken at your undergraduate level. You can go out to, in the Bay Area, we have the Berkeley Extension, which is a UC extension that offers courses like microbiology or neuroanatomy or neuroscience applications. So some of these other courses can also be taken, not just at community college level, but other institutions as well. It doesn't have to be where you're from. So it is really important that you do well and you get that done in terms of anatomy and physiology. If you like physical therapy and you're terrible at anatomy, I don't know how good of a physical therapist you're going to be. Anatomy and physiology is the backbone for any type of subspecialty in PT that you're going to get into. So if you're good at anatomy, you're probably going to make a good therapist. Okay? If you struggle in anatomy, it doesn't mean you're going to be a bad therapist. It just means you have to work a little harder at filling in some of the gaps and puzzle pieces for anatomy and physiology. Okay? So those are the 2 courses that we really, really want you to make sure that you're getting high marks in and going through and excelling in it, because it's that understanding of that material that's so important. It's just not the mark, it's the actual understanding of the material that's going to get you there. So these are some of the other optional courses that I think make you a stronger applicant, not just for our program, but for other programs as well. So things like neuroanatomy and neuroscience are very important. Organic chemistry as well as biochemistry, I think, is also an area of applicability for people that will bring a stronger science background into your application. Structural anatomical kinesiology, exercise phys if you have that. Some type of ethics course as it revolves around medicine would be great. Motor learning, motor control, also very important and applicable for what we do in the science of physical therapy. Psychology or motor development. Really, psych classes and abnormal psych are fundamental aspects of what you do as a physical therapist on a daily basis. I feel that 75% of what I do is not real hands-on physical therapy, but talking to people about how to overcome the impairments that they have or overcome some of the psychological barriers that they have to improving themselves. And so to have a really good foundation in psych is actually very, very core to kind of being a good physical therapist. And if you can articulate that in your application somehow, I think you'll also do really well at showing in each institution that you are going to be serious about interacting with patients and having good bedside manner and, being an actually, good clinician, not just somebody that's, really good at science. I think that's important. Intro to computers, because technology is moving ever so quickly, and to have good basic understanding of Excel or, PowerPoint or, other type of basics computer skill applications is really important. So utilizing that to your benefit is also very helpful. And again, these do not need to be taken at your undergraduate level. For example, my undergraduate, I actually went to San Francisco State. I missed the deadline for UCSF because their application is so much earlier than everybody else's. We require applications due, I think, October 1st. And so I went to Long Beach. And so to get to Long Beach, I actually took courses at Sac State in neuroanatomy and microbiome to be able to apply to PT programs and be a little bit more competitive. So don't be afraid of going to other institutions and grabbing a class here and a class there, because that will still get you some of those required pieces that will make you a stronger candidate. So if you have to take biochemistry through a community college and then take microbiology through some type of UC extension, that's great. It's going to make you more competitive than not taking those classes. So I think trying to broaden your science background and getting good scores in those science courses will, of course, make you a more competitive applicant overall. You guys have any questions on any of the science courses things? Yeah, go ahead.
So for computers, would you say, like...
Not typing. You can't just take typing.
I was going to say, like intro to programming or something?
Yeah, I mean, something that makes you data savvy. That's what we want to see, is that, you can work yourself through different systems and be able to navigate, each type of program analysis that you're going to need for the program, or for possibly, doing other things, if you wanted to do research or whatnot. So just something that lets us know that you are savvy with computers is kind of what it's all about. So not just keyboarding. Yeah, question back.
Yeah, I was told that I did not need organic chemistry.
Yeah. Most programs don't require it, and we do not have it as a prerequisite. It's just looked upon favorably. Okay. Yeah. Yes. Yeah, sorry. The question was that I thought I did not need to have organic chemistry to apply to the program. And that is correct, but you will be a more favorable applicant having gone through that if your packet looks exactly like somebody else's and you took it and they did not. Okay? So in today's world is very, very competitive, and one or two little variables will make you, I think, either have the ability to get into this program or not have the ability to get into the program. So things like this really make you a stronger applicant, We took 500 qualified applicants last year, and out of those 500 qualified applicants, we had 100 people we offered interviews to, maybe 105, 110. Out of 110, we have 50 slots, right? So from 500 qualified individuals, only 10% of them are going to get slots at the end of it. So it is very competitive, and it's not necessarily always GPA and GREs. Again, a program like ours has enough people applying that we can take some of the better GPAs, some of the better GREs, but we do look favorably upon people that have other components of science experience, as well as, robust education in it and getting good marks in your sciences. So these are great, and remember that they're a very important variable, but they're not everything. So don't not apply to a program just because you didn't take organic chemistry. You should still apply if you have maybe one or two others that will make you competitive, Especially being part of the UC system, it looks good that you went to UC Davis or some CSU here in California, because we want to serve California needs. And so our program, compared to some of the out-of-state programs, you're going to get better tuition, and you're going to get looked upon more favorably because you have in-state residence. Okay, so there's lots of variables. This is just one slide of some of those variables. So remember, there's lots of different things to it. And you guys can ask all those questions of what those are after we're done with this. So if you don't get a 3.0, you should wait and apply the next year. 3.0 is that base minimum. You will not make it through that screening process. You will not make it to the next step if you don't have a 3.0 in that all of those categories for things. So remember, it's not just sciences. It's the last 60 units or 90 quarter units of what you've been doing. Again, no Fs if you have any patterns of withdrawals or things like that. You know, everybody has a blip on their radar here and there. And if you've gotten a D your first year of chemistry, inorganic chemistry, you know, that happens. That happened to me. It happens all the time. But if you show some type of, you know, making up for that quickly and trying to change your ways and having the last 60 semester units of being really good marks, that's not going to hurt you very much, okay? So remember that each of these are different categories, and you will be competitive if you show the work to make up for anything that's happened. And we don't expect perfect A students all the time, okay? That's just not the real world of what we want real people to be. Because a lot of times people that are getting perfect marks and everything don't have those real world experiences that make them have the ability to interact socially with the patient, right? Bedside manner, that thing that's also very, very important for patient care. Good question. Other questions before we move on? All right, so we definitely want that coursework to be within the last 5 years of the prerequisite courses, okay? Again, if you had an optional course of like, you know, neuroanatomy and it was 6 years ago, that's not a big deal, but the prerequisite courses need to be within the last 5 years. Analytical writing and verbal and quantitative, you really want to be in these mark areas. And verbal and quantitative, if you get 70% or higher, you're going to get a little bit better mark even than that. In our kind of analysis process, we really look at a specific numerical methodology to be able to get you the highest score possible for what your experience is, as well as what your grades and GREs are. So we assign point system to each of these different things that you go through. And to qualify for extra points, it'd be something like getting a 70th percentile. So you get a couple extra points for that. And at the end of it, we add it all up and we see who's got the higher marks for things. And that gets you through screen process number 2. Okay, screen process number 1 is basic GREs, basic GPA. What's the other process? And a couple other things that will get you through the quick, sieve. And then after that, it gets a little more scrutinized into these other processes. The other thing that's very, very, very important for any program that you do is volunteer or paid physical therapy experience. Okay? We look a little more favorably upon people that have had a paid experience because it means you're in the trenches a little bit more in depth. Volunteer hours are great, and you can just do a volunteer hours and get into a program, but you're just going to get a little bit more credit from us if you had a paid experience because it means that you really dedicated some time and effort and that you were in that environment with a little bit more depth of understanding, right? Because you're getting paid, you're going to have a few more responsibilities that someone that's volunteering won't have. So if you guys have the time to spend 6 months or a year doing a physical therapy A job, either at a hospital or an outpatient center or something, it's going to be better for you because you're going to have more patient experiences to write about in your personal statements. And you're going to have better understanding on how that all looks in terms of that experiential knowledge when you get to the classroom. Yes?
I noticed with becoming a physical therapy aide, it's been a little bit competitive with physical therapy assistants because a lot of physical therapists have told me they would prefer an assistant versus an aide because they are accredited to do certain things that an aide cannot. Do you think that plays a factor upon, I don't know if you know much about the Bay Area or if in California, that is something that is more of a preference in your area or?
Yes, so I can definitely speak. This is probably for the inpatient world as well. For the outpatient world, a physical therapy assistant is going to be more valuable to the physical therapist that's treating those patients because you will have legal abilities to do things that a physical therapy aide will not have. Now, for budgetary reasons, hospitals and private clinics will hire physical therapy aides because there's lots of other things that need to get done in that environment that you don't necessarily want to have somebody that has a license or a certificate spending the time doing. So sometimes it's applying modalities to patients that are simplistic and they don't require a lot of brain power to, put a certificate or a license on the line for when you do it. So things like ultrasound or things like electrical stimulation setup or things like applying ice or heat or different other modalities that are there. The aide gets great experiential knowledge because they're next to the patient and get to talk to them for the 8 minutes that they're doing an ultrasound for if they're doing that. and you get to interact and get a little more depth understanding of what that patient is going through, and you're still going to get, paid doing that. And that's not something that a physical therapy assistant needs to be able to do. Now, if it's other hands-on skills where it's doing manual therapy for a patient, a physical therapist assistant is going to have more opportunity for that. But remember that each hospital and each clinic is going to have both types of practitioners there. So the physical therapy aide is a key and fundamental person for keeping the logistics working in an environment, in a clinical environment, and keeping costs lower, because you don't have to pay someone as much as someone that has a certificate from a program like a PTA program. Now, for all of you that want to go into a physical therapy role, you don't have to be a physical therapy assistant to get into a physical therapy program. Okay? They're different professions. Well, they're different avenues in the same profession. So you're not going to be a stronger applicant necessarily to get to a physical therapy program by being a physical therapy assistant first. Okay? It's usually two different roads that people go down. And usually being a physical therapy aide, it doesn't look any worse than being a physical therapy assistant in some ways. Okay. So definitely a variety of experiences though. Where we're at, we like 3 different experiences if you can. So doing an outpatient is great, but we'd like some type of inpatient, and then one other variable like hand therapy or pediatrics or burns or wound care or women's health or some other type of environment. So if you can have 3 different environments, you're going to be a strong applicant, I think, for most programs, and especially for ours. The important thing about these environments is just not checking off hours, but actually understanding what the profession is doing in that environment and what experiences, concrete experiences, made an impression on you, right? And how did you relate to that? And how did it shape your passion for being a physical therapist even more? So if you can find those experiences either in volunteer work or in paid work that you can really articulate specifically about how it related to you and what you enjoyed so much about that, you're going to have a stronger statement when you do your personal statement, and you're going to have a better interview when you go in to have actual interview time. Okay? One of our interview things is really looking at what patient care experiences you had and how it made you feel. Okay, and that's very important. And it's not bad to have learned from physical therapy assistants, but really trying to coordinate and get your letters of recommendation from physical therapists is the important part. Okay. Research experience is another area that we look very highly upon. There are a lot of research dollars at UCSF, and so there's a lot of opportunity if you wanted to be a student research assistant to get a paid position in a research area. So it doesn't have to necessarily be physical therapy. It could be in oncology or cardiovascular or women's health or pain, lots of different areas of medicine, and being a research assistant in those areas is great. So some of the research assistant positions that you'll find are going to be laying out slides, kind of like in a microbiome lab, of different things that you're going to interact with on animal models. And then other experiences are going to be with real life patients. So there's lots of different benchmark science going on at a place like UCSF that you can coordinate lots of different care. So if you want to go to, say, USC, I would go down and try to contact somebody in the research world at USC and say that you want to collaborate in some way, either on a volunteer basis or trying to get an SRA position to be able to do that. Same thing at UCSF. If you think that UCSF is the place for you, try to contact the department and see when they are hiring for their student research assistant jobs and be able to apply for that and get that experience. Okay? You'll be a stronger applicant if you know somebody in the department or a department related on campus at the place that you want to go. That's just going to make you a stronger applicant. It's just no nonsense, right? If people know who you are, you're going to have a better chance of them recognizing you on the application. Okay? So try to find where you want to go and spend some time and energy and invest in that particular location. I think is an important thing, for our program as well as other programs that are out there. It's also important to kind of gather some type of faculty interaction, because at least one of your recommendation letters needs to come from a faculty individual, either from your undergraduate or your postgraduate studies. So you want to develop a good relationship to get that reference letter. Okay, those recommendations are very, very, very important in the application process. So if you can go through and develop some type of relationship with a faculty member, it's going to do you very well for having them articulate in the letter specific things about you that differentiate you from all the other people they're writing reference letters for. Okay? Some people write a reference letter that's generic and you can see right through that right away, and they didn't really know you. It's much better to spend an extra year and develop some of these other qualities and interactions so that they can talk specifically about you and what you look like, not just he was a good student and got this mark. Okay? That's much more important. Extracurriculars are also very, very highly looked upon, and it doesn't have to be participating in sports because we are physical therapy. Doesn't mean that you have to be an athlete to get into physical therapy. It could be organizations or outreach programs or serving underserved communities or going out and learning how medical Spanish looks like in a free clinic or something like that. It could be all kinds of different aspects. So think about what we're trying to do here in California and what would serve the people of California the best, because that's what an institution like UCSF would really strive to look at. All right. So other programs that are out there that will help with your application process would kind of collaborate with those things as well. So these are just some of those ideas that would look like. You guys have questions on any of that? No. Remember, at least one of the recommendation letters needs to be from the actual clinician that you interacted with, so a physical therapist, and 2 from other type of employers, but one of those should be a faculty member, at least one of those. Okay, so PT clinician at least 1, faculty member at least 1. Okay, and then the other person should be able to articulate thoughts about you as an individual, not something generic. This is, again, our application process. Starts in June, finishes October 1st. We are one of the earlier programs that have a cutoff date. So that deadline, I think, is at least a month before anybody else's. So it's something that you want to get on and not miss. And tuition rates have gone up, as with all the UCs, as you guys know, and CSUs as well. So it's not going to be as much as the private institutions, where if you go to a private school, it's probably going to be $180,000 to $200,000. So we're at least half of that, but it's not as cheap as it used to be. Okay. There are lots of opportunities for financial aid. I think that's the next slide. Yeah. So there are lots of different small award amounts that you can go out and get creative at getting. And so because it's a UC, you're going to have some state-funded opportunities as well as federally funded opportunities. And so most of the students are getting some type of assistance through some type of program. Okay, so regardless of what racial, socioeconomic background you're from, most students are going to get something because they go out to try to get some type of award that will help with some of the scholarship for that. So you just have to be a little bit creative and a little bit of a go-getter in terms of going out and finding some of these resources. Oops. And so for more information, if you guys want to look at any of those things, my email is also on the UCSF website that's listed there, and it shows you lots of different opportunities and educational programs that we have going on there, as well as some of the research bodies that you can hopefully coordinate with. But I highly recommend, if you have not gotten research under your belt at all, to go out and find some type of research. It doesn't have to be physical therapy, but some type of medical-based or biological science-based research going on. It's a very good skill set to have that scientific methodology understanding. There is advising that goes on at San Francisco State, and so you can make individual appointments by using some of the information here. All right. That is pretty much the prezzo for specific to our institution. Again, some of the other things that we look at for points-wise when we're scoring that second screening is definitely looking at, are you from a UC or CSU school? We give you credit for that. Having academic honors, again, no D's or F's. Trying not to get C's in any of the prerequisite work. Looking at most of the completed work done by the winter, so you don't have a lot left over in the spring, hopefully not too much in the spring at all. Doing 2 or more highly recommended courses, which was on the presentation earlier. involved in a couple of different types of extracurriculars, so not just all your eggs in one basket with extracurricular. And so if you don't get in the first time with our program, I think it's definitely to your advantage to apply a second time if you really are set on, going to UCSF, SFSU program. We actually look highly favorable on people that are persistent, and so that's actually a great thing as well. And I think really writing a very good personal statement it speaks wonders to kind of clarifying who you are and how you're different than everybody else. I think that's a really important component that kind of gets recognized when you're applying to graduate programs, because you're looking at your GREs and you're looking at your GPA, but everybody's got good scores these days. There's a lot of people out there, and so how do you fit in differently than everybody else? How do you bring either some type of socioeconomic or cultural experience that you've witnessed, and you don't have to be from that particular environment. You just have to be able to talk about it and what it did to you and how it made you, shape your perspective with your passion for physical therapy and patient care. So I think that's really important. So that's pretty much the details that I can offer specifically for the knowledge that I have into the aspects of, our program and most of the programs that are around there. So I'll take questions now specifically, yes, as you go.
What kind of research component does UCSF offer to the students?
Yeah, so we have Rich Souza is our biomechanist that does a lot of research in our department, and so he's somebody that coordinates a lot of the research opportunities that are there on campus in the Department of Rehabilitation Science and Physical Therapy. So he's based in radiology, and so as a physical therapist, he is working in the radiology department. And so it's one of those things where you see there's a lot of cross-collaboration of multidisciplinary influence in a program like ours, because we have so many different resources to, communicate with the nursing department, to communicate with the medical school, to communicate with some of these other programs that are going on. So you have a more well-rounded understanding of, how the medical model fits and what physical therapy fits into that picture. So I think it'd be great to coordinate and get some type of research in a physical therapy department study, but there's not a lot of those. As long as you are trying to find something that's related to patient care or medicine and have your research experience talk about that and what it does to your understanding of patient care, we're going to look upon that favorably. So again, it doesn't have to be in PT. It'd be great if there was, but there are not that many of those out there. So it's something that at least gets some type of benchmark science and research to be able to understand some of the scientific method a little bit more in depth. Good question. Other questions? How many of you guys are from California that are here? Most everybody, right? So again, looking at some of these other schools, just realize that a program like ours at UCSF is going to gear towards helping Californians. So California residents, that it's going to be, looked upon favorably, and we want to serve that population as much as possible. Other questions? You can be as specific or as general as you want. Yes? You don't have to think.
Prior to applying for the program, do you have to have already taken a course in medical terminology?
No, so medical terminology I don't think is a required course, right? It's
not a required course,
Yeah.
but I know for some universities they do require you to already have taken the course or at least be certified in it.
It is a good thing to have there, but we do not require that as a required course. There's lots of things that will look good for you dedicating yourself to the medical profession. So if you took, medical ethics, that's a great course. If you took, medical Spanish as an elective type course, that's a great course. These courses are not required. I showed you guys specifically what the required coursework for us was. And you have to realize that every program has a really slight difference from the other programs in terms of what the required courses are and then what the preferred courses that you've had as your experience would be. So you have to kind of fit what you've done in the past and what you're dedicated to accomplishing to fit into the program that you want to apply to. There's some programs that require biochemistry, and some do not. So if you know that you hate chemistry and you will not take biochemistry, probably shouldn't apply to that program. Okay. So just kind of match your strengths to the strengths of the program that you see that yourself fitting in. And then really research the program to understand what their mission statement is and understand how you will be a good candidate for them. Because programs want to know that you're interested in them, not just interested in PT school in general. We want a student that's dedicated to the things that we're trying to achieve there, not just, go in and just get your physical therapy education. Good question. Next question.
Can you briefly describe the curriculum as well as like how many weeks do you do clinicals and stuff like that? And where do you do them?
Yeah, that's a great question. Let me go back to that slides just so you can, because I don't know every course that we offer because there's lots of courses. So here's curriculum in year 1. And again, I think the focus year 1 is kinesiology, anatomy, and then getting into basic biomechanics, I think going through your orthopedics first series. So that's going to be year 1. So really kind of embed you, and we start in the summer on that first year. So that first summer is pretty intense because you're getting lots of anatomy, you're getting lots of kinesiology, and it's the advanced anatomy. Everybody needs to have done well with the undergraduate anatomy, but this is like understanding every muscle and which nerve supplies it, which blood supply supplies it, and then kind of what its origin, insertion, and all the actions that it does really specifically. So knowing it, not just memorizing it, but really knowing it. And then how that applies to patients. So that's kind of year 1. You will have in your first semester a 16-hour rotation in our faculty practice. So you'll come to our faculty practice, and the professors that teach in the program treat in this clinic. And so, like I said, that's a very different experience that you won't find at most programs. So you'll come into the clinic your very first, fall semester, and you'll go through a little rotation to understand, oh yeah, all this science stuff that I'm learning really does apply, okay? And that's important. In the springtime, I think you have your second clinical rotation, and so that's just kind of going through basic rotation for 8 weeks. In your second year, you're going to get a little more in depth. You're going to go through 2 semesters of orthopedics. You're going to go through pediatrics. You're going to go through neuro, and you're going to start into some of the research design aspects of things. I'll talk in the third year what you do with research. It's very, very fun, multimodal type things. And then kind of get a little more in depth on the analysis of what you're doing with that. In the springtime, you'll go to your second clinical rotation, the bigger one, which will, I think, be a 12-week series. And so that's going to be in your second year. So like I said, we distribute them through. And then in year 3, you really get into the meat and potatoes of advanced clinical hands-on aspects and hands-on experience. So your last clinical rotation is 16 weeks. And like I said, that finishes the week before you graduate. So that when you're done with that clinical and you did a good job, if there's an opening, hopefully that business or hospital will hire you. And that's, I think, geared towards making your life a little easier at the job search in a competitive market out there. So it really kind of sets you up for success, I think, is kind of what it does with that. In year 3, you'll also go through your evidence-based practice, which is basically doing a systematic review of some type of topic that interests you. So going out to the research and just kind of drumming up everything that you know on something like patellofemoral pain in runners. So if you're a runner and you love running and you want to know what kind of injuries runners get and why they get them, you're going to do a research synopsis, kind of like a review paper of what that all looks like, and then present it to the class at the springs of your last semester. And it's really fun. It kind of gets into the meat and potatoes of what that research design looks like and does it fit into your study, and then applying basic statistical analysis to it. So it's not so in-depth that you're doing your own research. It's just kind of collaborating all the research that's out there in that very finely focused viewpoint and repeating it in a very organized way, like a research paper. And sometimes those papers will get asked to be a poster presentation for our annual conference that sometimes happens in Vegas or New Orleans or Chicago, and you'll actually go and you'll present your poster to other health professionals in physical therapy. So it's very fun and exciting. Cool.
You said the first year was 16 weeks?
Oh, for the clinical rotation? No, I think it's an 8-week. It's shorter. You have 16 hours in your very first fall semester, so it's like getting your feet wet exposure. It's not really a long clinical. Any other questions? So yeah, I think to part with, I definitely know that it's a very competitive market out there, a very competitive application process. So you want to get as many opportunities and experiences as you can under your belt. But when you're in those opportunities, don't forget to make yourself, with your best foot forward so you make an impression on whoever it is that you're interacting with. Okay, those reference letters are very, very important. So trying to find a way to, get the experiences and then, show them that you're dedicated to this and make yourself identifiable. Some characteristic. It doesn't have to be that you worked there for 2 years to get that. Okay, it just has to be something where you show intrigue and interest in an area that they found that they can identify you with. Okay, that's the important stuff. Cool. Any other questions? Excellent. Thank you.